If you are interested in a belly-based breast reconstruction, should you do that before or after pregnancy? This is becoming an increasing topic of conversation as younger and younger women are being diagnosed with breast cancer and may not be done with their family planning, or they are women who are undergoing a prophylactic mastectomy after genetic testing. Pregnancies can happen sometimes unexpectedly, so you can't always predict when a woman will or won't get pregnant. But my recommendation to patients is that if you are planning on having children in the future, or even imminently, you don't want to have a belly-based breast reconstruction prior to that. Here's why. When we do a DIEP flap, we have to get the blood flow that is keeping that fat and skin alive before we reconnect it to your chest. The way that we do that is by kind of rooting through your belly muscles. And even though we do our best to keep your belly muscles intact and take little to no muscle with us versus the way that surgery used to be done where they'd take a lot of muscle with them, doing that still results in some muscle damage. It damages the nerves that supply the muscles and allow them to function appropriately. Because of this, you don't really want to have a pregnancy after that, because your muscles, your rectus muscles, your six-pack muscles, the ones that we go through to get the blood supply to the flap, they are stretched during pregnancy. And if they're not as strong as they should be because you had a DIEP flap, then they can stretch more. And you could have things like a bulge or a hernia if there was a weakness in the repair of your abdominal muscles. The other thing is we made your tummy very tight after that DIEP flap. That's why most women walk kind of hunched around for a couple weeks after a flap. And then you're going to stretch it all out with a pregnancy. So it is always ideal, in my opinion, and most other plastic surgeons, to do your pregnancy first. Well, what if you need breast reconstruction? What are you supposed to do? In those instances, I usually tell women, if they're open to it, to opt for an implant-based reconstruction and then switch to a flap in the future. But once again, this is very patient-dependent, surgeon-dependent. It's a very good idea to discuss with your surgeon, but family planning, plans for future family planning should always be discussed with your plastic surgeon. If you had a DIEP flap, did you do it before or after pregnancy? Let me know below.